Plague Inc. 8 million yung na-infect ng Ender Plague ko. Oh my god. Bacteria naman. 3,000.
To do our best to manage it medically and not have to resort to surgery.
What's this?
Flight 291 is now boarding. All passengers, please proceed.
Oh, they're spreading fast.
Our house became infested with an acute febrile contagious virus. Or as it's known on the street, the flu.
Ooh, the flu. Haven't been seeing much of
Okay, disease symptom.
That's true, actually, in like college dorm rooms, military barracks. Anytime you have people
Okay.
it's very easy to get sick and then get it.
In case we're attacked, this concoction will slow down the infected.
No.
Tastes like chicken soup. That's because it is chicken soup.
I would be just sitting out of my mouth all day if it was chicken soup.
No.
Stop making so much noise. It's just a purple.
Oh, it's a purple pentaphore. I've never heard of a purple pentaphore.
No. More infections than the hive. Yo.
Skin pearly papules to pop up. It happens more often in kids, people who share towels.
No. Cute.
I love when they just like rub them like that. And they just pop right up. Work at school.
Good morning.
Okay. Oh, Argentina chili. Chili. Infected 0. 40, 40! Oh, 50! Oh! Oh, a bee! Pili pili bam beep boop. Bari 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 bari. What? No. Mew. Mew. I'm not the
Is the last thing you want to hear in a surgical device.
Oh, 1,600,000. 1 year. 5 billion. Common cold. Do.
I've seen that in movies. They throw it in. Oh, that's it. I mean, you need to have
Disease.
that is not
Symptoms. No. Ooh.
It sounds odd. The only thing I can imagine is if you have a significant loss of cartilage, potentially a labral tear. But there's other procedures that you can go about from an orthopedic standpoint rather than just replacing it. That promise on It's funny you say that because one of the first cases you learn about in the hospital is Hawkins versus McGee. You might have heard of it locally because it's called
Anarchist bomb, said Asha. Oh, 2 million people dead. Nasa Pilipinas, buti naman. Kasi Pilipino ako. Oh my god. Yeeshi. Oh, nandun yung shoes ka lang. Kinal. Armada.
When in reality, sometimes X isn't what's best for the patient. And
Italy, nasaan ikaw dyan?
Like 291 is now
you're not giving the patient and then they do something like label.
Oh! Oh no! Oh no, no you don't. Yeah, death!
It is obviously good that she's done some research here.
You're 29%.
Therefore, negligent based on it. So often in cases like this, at least the manufacturer so my knowledge, medical manufacturers will give
Oh my
things are
Not you. Not you. Oh, 35 more. 35 more.
I tried.
35% more.
Wait, tomorrow? What is that? That's ridiculous. This is a conversation.
Daily
that they would be having on
infections.
day 1, on day 2, on day 3. This would be a multi-year process. But the jury's
40? Yeah, 40. On smoking.
That's a little misogynistic there. I mean, so there's a whole science to presenting yourself. This is going a little bit crazy in terms of this specific.
Oh!
There are whole memes on the internet. Tattoos all over his face, his tie like down here, and like his suit out and stuff. So you don't want to.
Oh, dear.
Okay. As someone who knows a fair bit about men's fashion,
No.
what do you notice about this guy? It's different color, and
Dead! 9 million people.
which
I'm
is
the owner of the flag.
the most pretentious thing you could possibly
The
wear.
deadliest
With a suit,
flag.
I would say contrast colors. Now, there's nothing contrast colors. I believe that there's only
36.
Blood
36.
venue amputation is usually a more aggressive one. If you can really go below the knee for stability purposes.
2023.
Also, there's a lot of blood vessels here that are very dangerous. So most
Yo.
patients when they receive blood amputations, usually it's like diabetes, complications, below the knee amputation. It's rare for me, at least, to see. I imagine you want
Wow.
to rise when the judge comes in. There's a whole
36.
science and pseudoscience to make
No, not you, not you, not you.
Notice he's not wearing a tie. Makes sense. He's a young guy.
Oh, yo,
Nice.
something.
But
Yes!
get that jab and you say, oh gosh, I can't stand up because of this horrible thing with the dog. Really driving home the point. It's not going to show up on any transcript.
Oh my, 100 million. And the flag. What's up?
You are going to get a crash course education in
Spanish.
orthopedic medicine and post-operative infections. And you're going to hear words like pseudomonas and Ebola.
No.
So there's some awesome thing, like, I'm not a doctor, but you want to pair that with making the defense seem like they're...
Yes, deadlier.
Make it more deadlier. You're going to tell them exactly what happened as you're hiding it. In an opening statement like this, what you want to say is...
Make it deadlier. Oh, smallpox.
But you want to transition to the one thing you want the jury to remember.
Oh my god. Oh my god.
You say,
Here,
despite all
bro.
this complicated stuff, and we're going to explain it to you, the one thing
No,
you need to
110 days.
Dr. Torres agreed to perform a surgery she did not fully understand. We will establish that Dr. Torres had made a series of faulty decisions
Symptoms.
to Travis Green have thrived.
Oh, lethality. Oh, yeah. Lethal. Kailangan natin fall properly.
One carelessness.
So that's not bad. It's a little argumentative. In opening statement,
Yeah. Argentina declares national emergency. No!
This doctor did something
Dead.
she didn't understand. If I was the defense,
No.
you just disprove that.
Oh my god, 40 million.
My closing argument would say, remember when the plaintiff's attorney said,
Oh,
victims. She did 100 hours of research, corresponded with the manufacturer, brought the manufacturer rep out to participate in surgery. She knew.
Is it true that in medical malpractice cases, unlike the burden of proof being beyond a reasonable doubt, it just has to be more likely than not?
That's exactly right. And that is the case with all of these.
yes.
Alright, let's start closing irrigation, please. Wait, the sponge count is off. We're missing one sponge. Are you kidding me? We can't close it until we find it.
So this is true. We do a very careful sponge count before and after the procedure prior to closing.
Yes.
As you're well aware, sponges being left in patients, tools being left in patients. In fact, I remember when we were operating, we would have on the wall all the sponges that we were going to use for that case. So there would be like 30 sponges on the wall in little pockets,
Yeah.
almost like the shoe things.
Right, yeah, that makes sense.
And then as we take them out, we put them back in. And we've made certain adjustments where before we would just use sponges by themselves.
No.
Now they have an attached plastic ring that makes it easier to spot. We could also leave that plastic ring outside of the body so you know to take the sponge out. So there's been a lot of adjustments to improve here, but clearly it still happens.
Are you saying that Dr. Torres knew she left the sponge in Mr. Reed's body and she didn't care?
No, of course she cared, but
No, but still, she knowingly left
Who
the sponge.
is this on the stand?
Exactly. This is one of the nurses or doctors in the hospital. So the plaintiff,
6 billion?
apparently, his first witness, has called a hostile witness. That is juries
Oh my, 90% dead!
have the primacy and latency. So they're going to remember what they heard first, and they're going to remember what they heard last. Yes. So using that
Ah,
to your advantage,
240 days.
you recall
No, not you.
the entire sad story of what happened to him, or call your expert who is going to explain
On your side.
all of the medical stuff from the secondary
My
material.
god,
You would
death.
never call the witness
Poop death.
is basically on the other side.
patient was running out of time. She would have.
Hut, hut.
And you would not believe the sponge I found in the sink. I mean,
Hi. Hi.
Yes, that would be relevant, but that's like the
Hi.
most important objection to make here. He's just telling a story. I got this kid.
Hi.
He's a real
Hi.
mess. He left
Yeah. Boom. Oh. 1 million. Oh, no.
recovering well?
There's barely.
Yeah, and then.
Oh my.
There. I hear you got quite the fever. Temps 103 and just starting as workup.
There's barely
She said
any
this is weeks
infections.
apparently.
But weeks
There's
later,
6
she just
billion
see him for the
deaths.
first time?
Death.
Like, she would see him the next day.
That sounds
That's
negative.
literal killer.
Right down, Travis.
Wait, he
Yeesh.
went home with a fever?
No.
Post-surgical fever can happen, and there's like a thing that we remember in medical school called the
Oh.
5 W's: wind, water, walking, wonder,
400
drugs.
million
And they
more.
all mean something different. UTIs, pulmonary embolism is one of them. Wind being pneumonia, medications that can be taken because of fever. And you try and rule things out. But the fact that he went home with a fever, and he's 103, that's a really high fever. That should be thoroughly investigated.
How do I get anything? Any,
So we are listening to the heart.
Travis, I'm just gonna take a look at
Did
your
it listen to the right side?
Okay?
Well, it's funny, when you listen for heart sounds, you actually listen starting on the right side of the body. And a lot of people, patients that are medically in tuned from watching shows or have some curiosity, I say, doctor, heart's on the left side. I'm like, well, there are blood vessels that come off the heart that are on the right side that we listen to as well. The pulmonary artery, so you want to listen there and then make your way aorta, listen to the chambers of the heart. So, yeah, we do listen on the right side to hear the heart.
oh wow.
When we give medical
Dun,
feedback,
dun,
we
dun,
listen to
dun,
the patient's lungs, we look at wounds, unmetrics claim of feeling. So we don't say that sounds scary, that's good, that's is either normal or abnormal, and they keep it at that. A little infected.
Okay.
It looks like it's on.
No.
What I'm seeing
Yo!
all kinds of reasons why
Morocco bombs
could
infected
have not only
cities.
contributed to the
Bomba?
initial malpractice, but committed its own malpractice as well,
Oh
which is that this patient is being sent home too early.
Yes.
This patient
So
is
sad.
not being checked on regularly. And to the extent that they are checking on this patient, they're not examining
That wound did not get infected today. That's been an infection. And generally speaking, after you have surgery, you have not only follow-ups with the surgeon, you have follow-ups with your primary care doctor, all of which times we do vitals, we check the wounds. In fact, anytime a patient now is hospitalized, we have one of our nurses call the patient the next day to make sure they understand the medicines they should be taking, what symptoms are they experiencing, and if anything is off, they come right back.
And what about the murmur? Could the infection have traveled to his heart? His vitals are stable, so first we gotta clean out that joint. Okay? We can't afford any delays.
See, another thing that's unusual. How does she know the wound?
$sign on top of the hospital.
Exactly.
And his doctor might as well be just taking wads of cash.
Honestly, I think if you can probably create your own law firm that just targets their patients, because you'd be very well.
Post-op infections are very common. They happen all the time.
Is that your professional opinion?
It is.
And in your professional opinion, is it also common for a post-op infection to result in a double amputation? Does that happen all the time too?
You don't know what she's going to say right now. She might say,
Yes.
in a situation like this, where this went wrong, his
I need
heart
something.
blew up, he had a
DNA
lung problem.
points.
Yeah, that's exactly what I would expect to see. These doctors did a fantastic job that's completely impeccable.
What would he have done?
Thank you, Your Honor. I appreciate the questions.
Why didn't you page me sooner? We just heard the murmur this morning. This morning? Yeah. Look at this growth. You knew he was a heart patient. This didn't concern you? Of course it did. That's why you're here. So what do? The infection is eating away at his brain.
So not only is he having a fever because his joint is infected, which she knew somehow without doing any diagnosis, but his heart valve also has an infection in it. It has actual bacterial growth on it. And she's only performing the surgery on his leg, but not on his heart.
You need to see this. I was changing his compression socks and I saw this. His leg's gray, cold. I can't find a pulse.
Why aren't you checking all the time?
Yeah, exactly. So when a patient is laying in a hospital, they're not just passively laying there. The reason they're in a hospital is because there are wound checks every few hours, neuro checks. The residents come in and round on the patient every morning, look at the wound, look at the leg.
You probably don't want to hide it behind possession of socks.
That's an ultrasound, portable ultrasound machine that we use to hear the reality of it. You don't need that for his leg. You can see that it's not getting circulation.
Okay, I've got to go and do an embolectomy.
I'm going to.
So an embolectomy, like they're saying that a blood clot has now traveled to his arteries. I can't even follow this. There's nothing, like, there's no medical sense
But,
around it.
I mean, doesn't that presume
No.
that it's flowing down to his
Arterial system.
in his legs?
Yeah, which means it did a full his body. It just,
If I don't try this embolectomy, he could lose his leg. He can live without a leg. Can't live without a functioning heart. Look, if you do the heart tomorrow, it gives him an extra day on antibiotics. Right? He'll be more stable.
Oh my
And the
God,
heart surgery
destroyed
will be
now
less
in
risky.
Philippines.
Christina, this is Travis Reed we're talking about.
Does
Infected.
the course of treatment change if you're dealing with a famous person?
it doesn't change that, but it does depend on patient. Like, if a patient's job is intimately tied to a specific function of their body, we will work harder to save them.
I see.
Yeah, so there is some truth to that. You may have seen like musicians play their instruments during brain surgery because they want to make sure they don't do any damage to something that's really important.
Whoa, that is cool.
But what's his symptom? Oh, he was febrile overnight, but his blood counts didn't.
Okay.
What's going on?
This is bad.
That's the one with purpose. So here's the weird situation.
People checking on him.
Yeah. Why is he the one coming in? And why are they so casually strolling in with the meeting? He's basically throwing their thoughts. And the fact that they waited to do his part, it's obviously she's guilty. I'm pretty
No.
This is a civil thing. He's not guilty. It's
No.
considered the hospital.
And notice where his places were started.
Oh, man. That's
If you want to see the rest of our analysis, click here for part 2 on Legal Eagle Show.
check out Legal Eagle.
100 days.
Hey
At
guys,
least
we
near
made a Grey's
2
Anatomy
years.
reaction video, and you turned it into a hit. Now the next most highly requested show was The Good Doctor, another show that I haven't watched.
Okay.
Good hand washing technique. Could be a surgeon, I don't know yet. Oh.
Play.
Well, calling for help is the right thing. That's the first thing you want to do in these types of situations. How does he know it's the drug he's in? It's pretty impressive. It's great. Putting pressure on a wound like this is the first thing you need to do outside of obviously calling for help. Anything you can do to stop the bleeding, put pressure on the site is important in order to help that person survive.
I'm saving his life and he's bleeding out.
You have it in the wrong place.
I think I remember enough of Anatomy 101 to know what the jugular vein is.
You would be in the right place if you were an adult. He's not an adult. He is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing. I can't really see where his hands are, but it's good advice.
Okay.
Don't take it out. Some glass. Don't take it out.
And Lord Kill.
Yeah. Who are you? Hello. I'm Dr. Sean Murphy. I'm a surgical resident at San Jose St. Bonaventure Hospital. Well, hello, Dr. Sean. Nice to meet you. By the way, just so you know, if you have an object inserted into you, object, I know that sounds kind of weird. If you get stabbed with a knife, if some glass goes inside of you, if a nail goes inside of you, never pull it out. Make sure you call 911, let the paramedics decide what to do, let them take you to the nearest hospital, because a lot of times what that object is doing is preventing you from bleeding out because it's putting pressure on the spot where the artery or vein was cut.
A special meeting of the board of directors. As much as I love you all, questioning one of my hiring decisions, did you bother to look up the definition of president while you were skimming the dictionary?
You're hiring him to be a surgical resident. My department over my objection.
The bureaucracy that you're seeing here is real. There are board members, there's presidents, there's employees, there's trust funds. So these things exist. They put a lot of pressure on doctors and presidents to make certain decisions.
Yes, he has autism, but he also has savant syndrome. Genius level skills in several areas. He has almost perfect recall. He has spatial intelligence, and he sees things and analyzes things in ways that are just remarkable, in ways that we can't even begin to understand. Those are assets, undeniable assets for any doctor, particularly a surgeon.
I'm not going to lie, I agree with the president on that. As a surgeon, it's important to have very good spatial ability, to be able to have perfect recall, to understand the anatomy perfectly, than it probably is to explain the complexity of a specific case and be able to communicate well with people. Most of the time, when you're a surgeon, your patient is not awake. That being said, I think it is still important for surgeons to be able to improve their communication skills, to be able to talk to patients, help them understand the risks and benefits of operations, and make sure that they don't force patients to go into the knife when they don't have to.
You seen her?
No, now go away and turn off the light.
Sure.
Ooh, resident beef. Resident beef. Oh.
I need you to,
I heard.
And here I thought this was going to be an all-medical show, no Grey's Anatomy drama. At least where I practice medicine, there's different on-call rooms for males and females. There are times where one of the call rooms may be unavailable, and you do have to have a male and a female sleeping in a room together. Usually it's not a problem, but this is unprofessional, folks. It's going to lead to drama. Lots of drama.
We don't have a relationship. We have sex. But
You have a sexual relationship. I wish I had vision like that. That's impressive. venous distension is caused by increased intrathoracic pressure inside the chest cavity. He's basically saying the veins in the arms are swollen, so he thinks there's some extra pressure going on inside the chest cavity. It can be because of cardiac tamponade, which means that there's blood, usually in a traumatic sense like this, inside the pericardial tissue, which is the lining of the heart. And
just
there's blood in
watching
there, and it
stuff.
makes the heart unable to beat properly.
The veins in your boy's left arm are popping. Intrathoracic pressure.
His chest is rising, he's breathing.
The chest is moving paradoxically.
Paradoxical chest movement is a consequence of something known as flail chest. If you get a trauma where a section of your ribs break from the rest of the ribs, that part of the rib cage doesn't move normally when you take a deep breath in and deep breath out. So the chest sort of moves paradoxically. That's what he's talking about. What happens during a pneumothorax? One of the lungs collapses, or sometimes both of the lungs collapse, and you can't oxygenate that area, meaning that when you breathe, no oxygen goes to that area. It causes increased pressure. The life-saving treatment for this is to literally insert a needle in order to release some of that pressure.
Who here has a sharp knife?
Oh!
Blade 5 inches or longer? Nobody?
Is he going to go into the second or fourth intercostal space?
Can't be back here.
Oh, I need a knife.
He's going to TSA.
A knife. Sure. Anything else?
I do also need a narrow 6'2" and high tooth alcohol and gloves and bag of handling tape. But I'm going to get the alcohol from the duty-free store and the tube from the back of the soda machine.
He's going to put a chest tube for a traumatic pneumothorax. Looks like he's going to a party with all that Jim Beam. He reminds me of Zac Efron a little bit. I know it's a weird thought to have in the middle of this medical emergency, but I don't know. I always found that blowing to the glove thing really obnoxious. How much bacteria do you have in your mouth? Probably even more.
Let me
You're blowing inside